Hello, my name is Luigi Biel, student in Dr. Rebecca Doyle's class for Health Languages and Health Literacy, and today I'm here to discuss the education program that was designed to be instituted at the Brownville Memorial Hospital. Brownville Memorial Hospital is a 500-bed multi-specialty hospital with patient-centered medical home status serving the urban community comprised of residents of Black, Asian, and Hispanic ethnicity in the area. The target population for this training workshop is aimed for all existing and new patient care staff, including physicians, nurse practitioners, or any other support staff that will be patient-facing. The goal for this training workshop is to increase the overall health literacy within the community to reduce health disparities amongst community members. Furthermore, this training will provide hospital staff with tools to better communicate themselves to patients to reach the goal of lowering hospital inpatient admissions. We should take a moment to discuss what is health literacy. From an academic perspective, health literacy is the degree to which an individual obtains, processes, and understands basic health information to make informed decisions on their health. While that explanation may make sense to healthcare staff, we need to be able to present this information to individuals outside the healthcare sector and assume they have no knowledge regarding healthcare. In the clearest of explanations possible, health literacy is the amount of health-related information that an individual can understand to make the best choices for their health. Before we begin, let's look at the community at large. Brownville Memorial Hospital serves over 750,000 residents. Socioeconomic status in the area is generally of a low level as the percentage of people who did not receive a high school diploma is higher than 30%. Additionally, speaking from a cultural perspective, the area is very diverse as there is a high percentage of Hispanic, Asian, and African American community members living in the area. This means that communication between the provider and the patient may need assistance to clearly relay directions to the patient. Areas of concern that this workshop will address deals with communicating clearly with the patient and encouraging them to ask questions to benefit their healthcare experience. Communicating with the patient is considered a fundamental aspect of medical care. Yet, research shows that patients commonly have difficulty in understanding medical instructions relayed to them by their healthcare provider. Healthcare providers have been found to deliver advice with overtly complex medical terms that perplex patients and end up confusing them even more. Basic terms are highly suggested to avoid confusion along with drive the point home. The amount of information is high for patients. This is true for individuals with many chronic illnesses. Providers should aim to reduce the amount of items discussed per visit to enhance retention rate of information disseminated. Brownville Memorial Hospital, in accordance with its mission, will develop, implement, evaluate, and provide resources to hospital staff that will lead to improvements for health literacy within the community. Hospital responsibilities will include ensuring that health professionals can obtain and provide the public health with accurate and appropriate health information. Project Brownville Happy will strive to address practicing the use of clear communication techniques while also encouraging patients to ask questions at the end of every encounter by implementing a 4-month health exercise from September to December 2018. Starting in mid-August, all healthcare providers will be enrolled into a mandatory cultural sensitivity training course that will educate them on how to best communicate with our patient population serviced at Brownville Memorial Hospital. In addition to this, all patient-facing employees will be branded as health literacy advocates with the added responsibility of encouraging patients to ask questions and partake in becoming more involved with their healthcare. Lastly, the hospital will be printing and posting several social health marketing infographics around the hospital to be viewed by patients to raise awareness of the program and encourage more questions during appointments. Communication with the patient will become clearer after mandatory cultural sensitivity training is held in August by enhancing the amount of information which can be made available to the patient without confusing them. Additionally, questions asked by patients encourage open discussion between the provider and patient by engaging them and making them feel involved in their own personal care. To maintain costs, most of the health initiatives being used in this program will be added onto current responsibilities for all patient-facing staff. For the social marketing campaign, the hospital will need posters or infographics which shed accurate information to the patient while also being clear and concise to capture the patient's attention. The hospital will also be creating education material areas which will serve as a checkout area for patients to sit with a health literacy advocate after visiting with the healthcare provider to go over the directions and make sure that the patient understands what was directed. Patients will be able to ask questions and patient education materials can be dispensed to them if necessary. The overall workflow for this intervention will include having the patient meet with a health literacy advocate prior to their scheduled appointment. This allows for hospital staff to interview the patient and coach them on what important items to meet with the provider about. The healthcare provider will then meet with the patient and educate them on their health and suggested treatment plans utilizing plain language and culturally sensitive communication mechanisms. Prior to finishing the encounter, the healthcare provider will provide the patient with time to ask them questions as well as perform a teach-back technique that requires the patient to repeat everything they have heard from the provider to display understanding in their healthcare needs and decisions. The patient will then be escorted to an available health literacy advocate for a second time to receive pertinent healthcare education materials in relation to their assessments and be given the opportunity to ask any additional questions. Patients will then be called after 3 days to administer a survey to gauge program performance and determine whether the intervention was a success. In this workshop, hospital staff will have to pair up with a partner and choose amongst one another who will be a patient versus who will be a healthcare provider. The patient will pick a chronic illness, and the provider will need to educate the patient with pertinent treatment information using plain language and concise words to treat the patient. Patients will then be given the opportunity to ask questions and provide a brief summary of what the provider taught them. Swap roles when finished and wait for everyone to finish their iterations. If time permits, perform another rotation involving a different chronic illness. In conclusion, hospital staff participation in this health program will help achieve an increase in the amount of information that is communicated between healthcare provider and patient using plain language and culturally sensitive mechanisms that enhance retainment. Furthermore, by encouraging patients to ask questions at the end of every visit, this will reduce health disparities and attain a better quality of life within the community. Thank you for participating in this health program.